Transfusion-related sepsis. After learning, students should be able to understand the pathophysiology of the reactions, explain causes and effects of the events, select an appropriate laboratory investigations to help diagnosis and monitoring of medical treatments, and the most important thing is to manage and select the best blood components for patients to prevent the reaction that may occur again. Transfusion reactions can be classified into two main groups, acute and delayed, depending on the onset of the reaction. Both groups are also divided into immune and non-immune mediated based on causes. Immune-mediated reaction means that patients produce autoantibodies specific to red blood cells, white blood cells, platelets, or plasma, while the non-immune-mediated reactions are caused by other factors. Bacterial sepsis is classified as non-immune-mediated acute transfusion reaction. Signs, symptoms, and manifestation of transfusion-related sepsis including fever, which typically over 38.5 degrees Celsius with chills, rigors, and hypotension during or shortly after transfusion. Sepsis from gram-negative bacteria causes more severe including shock, renal failure, and DIC. Abruptness of onset and severity of signs and symptoms of bacterial sepsis may similar to acute hemolytic transfusion reaction, and marked case may be confused with febrile non-hemolytic transfusion reaction. The key to diagnosing transfusion-related sepsis including first, finding of the same organism in both patient and the remainder of blood component. Second, color changes, especially brown or purple discoloration observed in red blood cells units and bubbles or frothiness in platelets. This table shows genus and species of microorganisms frequently found in red blood cells and platelets. This table shows how to differentiate sepsis from other transfusion reactions that cause fever. If transfusion-related sepsis is suspected, the transfusion should be stopped immediately, provide supportive treatments, and start antibiotics. In case of transfusion-related sepsis, suspected sepsis should be reported immediately to the blood collector so that other components from the same donation can be intercepted to avoid exposing other patients to contaminated blood components. Any other blood components or aliquots from the same donation that are in the hospital's inventory should be immediately quarantined, pending investigation results. Bacterial detection tests and pathogen inactivation should be considered.